but in a South Florida community, quite frankly, across the state of Florida. However, there are known cases across the country with a heavy emphasis in the West Coast. In fact, I just read that the state of California has been put on emergency status. The reason why we're having this press availability is, quite frankly, because of multiple requests for information about our level of readiness. I want to also say that I thank Mayor Jimenez for, we received information yesterday that he is planning to have a meeting to which we were invited to take place tomorrow to consider a community-wide plan on our response for the coronavirus, and I'm thankful for his leadership. First thing I want to tell individuals is that for the better part of 2 months, when we first detected these cases emanating out of China, we actually discussed this issue and debated this issue at the highest levels of our school system. Just the nature of the virus, the exponential expansion of the virus, how quickly then it spread to other countries and continents, told us that its arrival in this country was not a matter of if it would happen, but when would it happen, and where, and how far, and how widespread would it become. And I think we are on the verge of that. But there is no single case in our schools or in our community. So let's talk a little bit about what we are doing as a school system. From the very first moment that this threat was recognized, to the moment it was recognized as a pandemic, but a national pandemic in China, until it reached the level of global pandemic impacting various continents and countries, we went into action. And the very first thing we did is we pulled up our privileged pandemic plan, read it carefully, and made changes to it to adapt to this new threat. Secondly, we began an awareness campaign with our schools and our community of parents and our own workforce. What I mean is we generated information, easy to read, easy to understand in a multitude of languages that we could place on our social media sites, in our district website that could be passed out at schools, that deals with common sense practices that facing any type of communicable disease, whether it is coronavirus or the common flu, they are effective. So we let parents and students and our community know that the best prevention is, quite frankly, the old, true and tried personal hygiene. Wash your hands frequently, up to 20 seconds with water and soap. If you're feeling any one of these types of symptoms, fever, body aches, scratchy nose or throat, don't come to school if you're a student. Don't report for work if you are an employee. Why? Because you will be passing on the virus to others. And go seek medical attention. Go to the doctor. Do not postpone it. Not now. The next thing that we let individuals know is that even though this is not coronavirus, probably, it may be one of many strains of the flu. And it is important to recognize that. One of my fears is that we are perhaps paying so much attention to the coronavirus that we are ignoring other strains of the common flu, common cold that, quite frankly, victimize lots and lots of both young people and adults across our country. A number of things that we've done of late also focus on additional measures that we will take as a school system should, in fact, a declared confirmed cases of coronavirus be identified in our community. And here are the things we are ready to do. And these, by the way, some of them were discussed during yesterday's CDC press availability. Some are novel to us. Number one, it is important to continue to sensitize our community with information. We're doing that. Secondly, considering that buses pick up and drop off literally 60,000 plus children every single day. That is the first point of contact between children and our school system. We are installing hand sanitizers in school buses. It's a practice that makes sense. We are placing hand sanitizers at the entrance to the school, departure, and areas of large congregation of students, such as cafeterias, gyms, and venues of the like. Secondly, we are in a process of installing posters with this information throughout every single school and replicating once again this information to be sent home with parents through their children. Next, and I thought that this was important, in the eventuality that we may have to close a school or schools, we are ready to deploy digital resources, personal devices. In fact, it was determined today we have an excess of 200,000 devices. If we have to shut down a school for any reason, and that's a measure of last resort, or isolate classrooms of students where they would have to stay home, we are able to empower those students and families with devices, with digital content, so their education continues from a distance with digital content that's standards aligned, age appropriate, grade level appropriate. Next, we maintain very aggressive and daily communication with our own Florida Department of Health, as well as our local Department of Health. And as needed, we enter in communication with the Centers for Disease Control. We're following their best practices and recommendations, but we're going steps beyond that as well. One of the things that makes sense to us is we have a presence with telehealth in our schools. We have a presence with a means by which, real time, our employees can dialogue, convey symptoms to healthcare providers. We are putting on a fast lane communication with a number of local health entities to bring telehealth to our school clinics. In the case of an emergency, in the case of a declared symptomatic case that may lead to coronavirus, it is important to have that direct, instantaneous communication from the school, from the clinic, between a nurse and a health provider, let's say Nicholas Children's Hospital, without creating panic, but being able to communicate the information as quickly as possible. Part of this game is to eliminate layers, therefore eliminate time-consuming steps that would lead to the stabilization of these conditions. Critically important. We are an immigrant community. And just over the past few days, we received about 50 to 60 students from outside of the country. Typically, the practice and the policy is one, that any student coming in from outside of the country, they have a constitutional legal right to be enrolled in school. We're going to protect that. However, the change now is, because of this possible threat, the students and their families will no longer be registering the students at any one of the schools throughout the community. We will establish 2 reception centers to enroll the students. At those registration sites, one in the north and one in the south, there will be MDCPS staff, but there will be also a certified professional health official, a nurse, to be able to ascertain certain important information. Where are you coming from? Did you make any stop in certain countries on the way here? Why is that important for us? For the same reason that the cruise ships across the world are paying attention, for the same reason that different nations are putting additional protocols to protect their populations. I want to reassert that every single child, native-born immigrant that comes to our school system has a right to a free, high-quality public education. But we find it important at this point to streamline the points of entry and actually add a health person as part of the team that registers the child. Critically important to us. We will be providing over the next few days, and the go-live date for all these initiatives is this Friday, PSAs, public service announcements. We are putting together teaching videos, anywhere between 3 and 5 minutes, to be shown in every single school to sensitize our community of teachers, parents, and students on what the coronavirus is, what it is not, the precautions, the safeguards, and the preventive actions that we can all take as a community. This is important because we know Miami-Dade County Public Schools provides education to about 500,000 students every single year. 350,000 pre-K-12, an additional 150,000 adult learners. We transport over 60,000 kids every single day. We feed in excess of 250,000 students. If there is one entity where we have an opportunity to educate, to engage in prevention, where we can actually pass on information that scales up to the entire community, Miami-Dade County Public Schools is it. On the flip side, if there is one place where a contagion can actually spread, it could also be the schoolhouse. Why? Because regardless of zip code, they all come together and then they return back to the community. That is why this set of information, these protocols, these practices, and these preventive measures are so, so important. Last but not least, my chief academic officer recently conveyed to me that based on conversation with students, particularly high school students, more so than an approaching hurricane, which causes stress, kids are concerned about the coronavirus. They are discussing it in their schools. They're asking a lot of questions. They are worried. To a certain extent because of the hype, to a certain extent because of the unknown, to a certain extent because, quite frankly, they're kids. So we are deploying resources, counseling support, crisis support, to schools where there is a heightened level of anxiety, but also providing information to parents and educators on how to speak about these issues to the students in an age-appropriate, sensitive way that is in agreement with who these kids are and their level of understanding of the world around them. The last point, and this is an important one, it just happened. We are a system that believes in global education. We are a system that believes in world education. And sometimes we provide that through field trips, out-of-country field trips. Unfortunately, we've had to cancel 2 out-of-country field trips over the past 24 hours. One was to Italy. And I'm sure you know that out of all European countries, Italy is the nation that has the highest number of confirmed coronavirus cases, victims. We did not feel that it was prudent to transport students and their chaperones to Italy at this point. And we have imposed a moratorium until this situation stabilizes on all out-of-country travel because of the explosive nature with which this virus is spreading on the global stage. So I want to reiterate, any student, any employee will have access to information. Prevention continues to be the best weapon against the spread of this virus. We do not have a single case in Miami at this point, but we are ready. We have protocols in place to prepare a response, but most importantly, to educate the community on how to prevent the spread or the contagion effect of this somewhat mysterious virus. There's a lot we still don't know about this virus, and I continue to educate myself. We have some ideas about the incubation period, but no definitive information about how long that is. We believe we understand how it is passed on from person to person, but we don't have conclusive information on all the methodology or the process by which that happens. So considering the elements that we don't know, the most important and powerful tool we have is education on prevention and education on the symptoms that can be identified and then the steps to be taken by any one individual. I'll end by saying this. Whether it is the common cold, the flu, or coronavirus, if there are sick children or employees, the best place for them to be is not in school, is not at work, is at home in consultation with their primary care physician. That is the best way to prevent the spread of this virus. And then common sense practices. Don't cough or sneeze into the air. Do so into your elbow. If you have some symptoms, don't touch your eyes, your nose, or your mouth. And do not hide your symptoms. Information is the most powerful tool of avoiding the spread of the coronavirus. Any questions? Is there a what? A doctor here? No, no, no. We're an educational institution. Yeah, yeah. No, but we do have a health department that is informed by health professionals. And as I said, we are in constant communication. All of our practices are based on directives or best practices from the CDC, in addition to elements that we have put into place here at Miami-Dade County Public Schools.
Can you run through a hypothetical? Say there is someone who's believed to have coronavirus, a student, what would happen?
So hypothetically, and again, this would be done in coordination. We do not take steps unilaterally, in direct coordination with the health department. Should there be any one entity, an adult or a child, a parent or an employee that we know is exhibiting, manifesting the symptoms, we immediately advise the health department, and collaboratively we put into motion a number of steps, which could include isolation of groups of students, isolation of the entire school, closure of the school, even though that would be very atypical, surveys with the community in terms of relatives, those that had contact with those individuals, but at that point, that baton would be passed to the health department for our community. Hace más de 2 meses, nosotros estamos preocupados con el impacto que posiblemente el virus corona está teniendo en varios países al nivel mundial y en este momento en este país. Quiero asegurar que basado en los últimos informes, no existe ningún caso de coronavirus aquí en nuestra comunidad y no sabemos de ningún caso de algún estudiante o maestro o empleado o padre de familia que sea víctima de este virus. Pero estamos preparados no solamente para educar a nuestra comunidad en la prevención contra este tipo de virus, pero también cómo responder a un caso que pueda suceder aquí en nuestra comunidad. Eso es basado en información que hemos obtenido del Centro de Control de Enfermedades Nacional en colaboración con el Departamento de Salud Estatal y Local. Y los métodos, los pasos de prevención son fáciles. Hay que lavar las manos muchas veces durante el día, más de 20 segundos con agua y jabón.